am so excited to have Dr. Lerner here. He is one of my all-time favorite pediatricians. I met him when I was doing my residency at UCLA, and he was my clinical advisor. He taught me so much about pediatrics and how to practice medicine. So I cannot wait to pick your brain about common questions that I get about childhood development.
Sounds good.
Okay, so I thought I would just start off. Can you just tell us a little bit about yourself? I find what you did before working at UCLA so interesting. Maybe just tell us like where you're from and how you ended up coming to UCLA.
Sure, of course, yeah. So Jessica, one of my star students a long, long time ago, so it's an honor to be with her. She has far outstripped her teacher in the ensuing years, but nevertheless, I'm happy to contribute to this podcast. So I'm originally from Argentina and moved to the LA area during middle school and spent some years sort of across the country for my education. And finally ended up for several years after finishing my pediatric residency working for the Indian Health Service along with my pediatrician wife, where we had our two kids who are now teenagers. I moved to UCLA about 14 years ago, really to get closer to family after spending many years in a fairly remote area.
And tell me about the Navajo. How long were you there for, and what specifically did you do?
Sure. What the experience there was really one of the most amazing personal and professional experiences for both me and Ellen, my wife. The Navajo live in a large area in what's called the Four Corners areas, Arizona, Colorado, Utah, New Mexico area. Beautiful high desert setting. And because they still live in what's their ancestral lands, they have preserved many of their traditions and ways of life. So it was really a true privilege and honor to experience sort of life in that setting. And we were general doctors there. We actually saw all ages, and whether it's for regular visits or for emergency causes, a true old school doctor for the community. And there were several of us in a very remote location. And we grew to love that area and its people, and we still miss it.
That's amazing. Have you ever been back to visit?
Yes, we've been back. We have sort of strong attachments, personal and otherwise, to the area. So when it's again difficult to get there, it is fairly remote. But whenever we get a chance, we've visited.
It's really amazing. And you had both your kids there.
Yeah, that's right.
And then at UCLA, what kind of work do you do at UCLA as a professor? Do you?
Yeah, so many of us working in university settings wear a variety of hats. I do still see patients and see patients also along with residents, so teaching is a big part of what I do. I spend quite a bit of time caring for children that are what's considered medically complex, that may have multiple medical issues and even need the help of technologies to stay healthy at home. And we have a program to really look after those kids, and that's one of my primary professional focuses, but also an area where I do research in terms of figuring out the best ways to care for this group of kids.
Okay, so what I wanted to pick your brain about is so many questions come up with parents about children and their development. They all worry, is their child developing appropriately? I mean, probably every day I'll hear a parent say something like, you know, they're worried about their second child because their first child hit a milestone sooner than the second child, and they're concerned. So I thought it'd be helpful for anybody listening if we went through some of the general milestones and some of the general concerns that I hear about, and maybe we can talk about when to be concerned and when not to be concerned.
Yeah, no, actually that sounds great. Thank you for proposing this topic. This is such an important part of what we do as pediatricians, is to, along with the families, sort of monitor and interpret and understand the child's development. So it's really a core part of what I do every day. So I appreciate the opportunity to chat about it.
So let's start first. I was thinking with what we call gross motor skills or development with children's, muscle capabilities as they grow up. Can we briefly just sort of touch on what milestones we'd expect to see with gross motor skills as kids grow up? Let's say from briefly from birth through maybe 2 years old.
Sounds good. Yeah, so
Sounds
we
good.
can go through it. And I think a big caveat here is that I think many families do look up on various resources or on the internet, what is my
Yes.
child to be supposed to be doing at a particular age.
Yes.
But even for each of these milestones, and I'll touch upon that as I talk to a couple of these, there's really a range of what's considered normal. And it's in many cases what you might see is maybe slightly off from what the textbook says or the internet says, may well be completely normal. So it is an opening to a conversation. It is worth
Yes.
noticing and discussing with your pediatrician. But in most cases, I would say it doesn't necessarily represent a problem. So, but some of these, I think, if for families that have babies, they've observed this. So when a newborn comes to my office, they can't do very much in terms of moving around, but if I do put them on their belly, they are able to get their head out of trouble and lift it up. So that may be a first motor milestone.
Yes.
By the time they're 2 months of age and their next visit, they're lifting their head up a little bit more, maybe 45 degrees. Then what follows at 4 months of age, they may be lifting their head up all the way 90 degrees and pushing up with their arms, really getting ready to roll. If you look up, again, in a textbook, it may say, well, by 4 months, babies are supposed to be rolling from their belly to their back. My experience is that the majority of babies are not quite ready to do that at 4 months of age. And I do have a theory about this. I think it is easier in theory, to roll from belly to back. But now with our emphasis on having babies sleep on their back, they don't spend a lot of time on their belly. So they've really lost that early milestone at 4 months. And
Yes.
I have many babies that are rolling from back to front before they even are able to roll from their belly to their back.
Yes.
So it may not be till 5 months that your baby will be rolling, and I consider that completely normal. The only thing I might say is keep doing that tummy time, which I think it's valuable for other reasons, but I'm certainly not concerned if I don't see that. Nevertheless, I wouldn't leave a baby at that age in any high surface without a hand on them, just in case they don't surprise you. But so they could start rolling by 4 months of age. Similarly, I think if you look up in a textbook, you may say, well, by 6 months they're supposed to be sitting. And I don't think that's quite accurate. You're starting to sit maybe with some support, sticking your hands out, and maybe stay there for a few seconds. By 6 months of age, is really by 7 months that you're sitting solidly. If you plop them down on a surface, they may sit solidly by 7 months, although you might start to see some of that by 6 months of age. The next big milestone may be crawling. Now, crawling is extremely variable. So we actually don't really use crawling as a measure of the child's overall development. Some kids, as your audience may know, never crawl. They go straight to walking after they turn 1, and they may get around in many other ways, rolling around or creeping around. So it's interesting to note whether they're crawling, but in my mind, it doesn't really matter whether they're crawling or not, as long as they're doing some of the other skills that I mentioned.
I'm so glad you brought this up because I've noticed there's this emphasis from parents about crawling. They worry if their kids haven't crawled, that this means something bad about their children, that they've missed this milestone. But I agree. In my experience, kids that have missed crawling, as long as they go on to walking or continue to advance their milestones, it seems inconsequential.
Yeah, in fact, it is not considered a milestone that's predictable, meaning the absence of crawling doesn't raise any concerns in my mind unless there's something else that's going on that may worry me. So, but if you look it up, at what age are kids crawling, you may find that says by 9 months babies are crawling. We'll see some 6-month-olds that are crawling, and we'll see some 1-year-olds that never crawled, and they both can be completely fine. So
right. What I usually tell parents is just to expect they'll be mobile in some way, that they might go from point A to point B, whether it's by rolling or army crawling or crawling, and more just as a reminder to be careful with baby proofing and
Yes.
keeping,
If nothing else, it opens
Right.
a conversation about child proofing, because
Right.
things definitely change when babies start to get around.
Right,
and,
right.
and even more so as they get vertical and start to pick up and stand up, holding the side of the couch, etc., and which typically happens at around a year. And once again, I think that the standard answer for when babies start to walk is maybe a year of age, but that's, I would say, the minority of kids are really taking steps by that. They're certainly not unusual to be walking at 12 months of age, but it's certainly not my expectation that they will be doing so. Right. If you're holding their hands and helping them walk by 12 months of age, the majority of babies may be walking. A high fraction of babies will be walking by 15 months, but even in the few that are not, I don't start to really worry until 18 months of age. And by worry, I mean looking a little further into it. By 18 months of age, if I don't see walking, as long as the other things are reassuring and they're getting up to the side of the couch and getting around, even a 15-month-old that's not walking may catch my attention, but really not concerned yet. By 18 months, I may start to say, well, what else should we be looking at if they're not walking by then?
I'm so glad you brought this up, because I think there's this notion that every kid should be walking at a year. There's this idea in the head that at a year, kids should be taking their first steps at their birthday. But I agree with you. I often see kids not walking till 14, 15 months and sometimes 18 months. I've even had kids walk later than that, and they end up being okay. It does not raise any alarms for me. I just may pay attention to other aspects of the child's development, but it does, like you said, does not raise any alarms for me not to see that. Yes. No, I'm so glad we're talking about this, because so many times a parent will say, they have a friend or a play date where the child's walking at 9, 10 months, and they're very concerned when their kid is 15 months and not yet walking. But it's amazing what a range there is with walking.
Yeah, and I think as an instinct, it's actually helpful for parents to be attentive to that. What is my child doing? Are they doing what they might expect to be doing? What we can do as their pediatrician is provide some context for when should we worry, should we investigate further, or can we be reassured that this is okay? But yes. Parents are our best guide to raise concerns when the concerns exist, of course. So we really rely on at least what the parents are observing. So I'm glad that their parents are worried, but I'm glad that we have the opportunity to discuss it so that I can be reassuring in the cases when that's indicated. And the larger point is for when there are more significant problems, the motor skills are generally not what tips us off to those. It's not impossible, but it's pretty rare for gross motor skills to be the first sign that we're having a problem. Again, not to say that never happens. Of course, there are kids that have conditions that require investigation, but it's pretty unusual.
Yes. You're saying you'd see other areas of their development that are behind.
Usually that's more the focus of my attention is our other components of development. That's right.
Yes, I would agree with that. Well, thank you for that. Okay, so now moving on, if it's okay, to verbal skills. Also, are there any kind of, just briefly going through some verbal skills that we'd expect to see kids acquire as they grow up through the first couple of years?
Sure. Yeah. So of course there are. So the perhaps the first big one, which may be an overlap of a social or a verbal skill, is to hear some giggling or laughing at 4 months of age. That's perhaps more of a social skill, and that's always a thrill when that happens. By 6 months of age, we expect to hear some form of babbling. It doesn't have to be what we call mature babbling, which is combining consonants and vowels like ba, 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 ma, ma, ma. That can take a little longer, but some sort of exploration of their voice or noises, whether it's pure consonants or pure vowels, happens by 6 months of age. And we really do expect to see more mature babbling, more of the typical ma, 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 ba, 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 by 9 months of age. On average, you may hear the first word at around a year of age. Again, I see some variability here, and it's not, to me, a sign of concern that I'm not yet hearing it right at the 1 year visit, as long as I'm hearing some babbling. But then beyond that, over those next few months, language goes fairly slowly. At least what we call expressive language, the ability for the child to say words. So about a word a month over those between 12 months and 18 months is what babies acquire. So they may have 6 or 8 words by 18 months of age. Now, of course, parents can point to examples in their own child, or maybe the neighbor's child, that are speaking much more than that. So there is quite a bit of variability. But in terms of our expectations, what we may expect on average is about 1 or 2 words at a year of age, and then acquire a few more words, about a word or 2 a month over the next several months.
And what about, so let's say you have a kid that hears 2 languages in the house. Can parents expect that their kid will be delayed? Is this something that you advise doing?
Well, I think it's a great idea to be exposed to multiple languages if it works within the household. There is information about that. There are studies about the benefits for brain development of that exposure to multiple languages. So the answer is unequivocal. By all means, if you are in a position to expose your child to multiple languages in the household, go for it. It is true that it can slightly slow down the acquisition of expressive language, the ability of the child to talk and say words. It is more that they're having to process in their brain, so it takes a little longer to get going with the language. The caveat here is if there are significant delays in how the child is talking, I never point to the bilingualism in the household as the reason not to look into it further or to provide support. So if the delays are significant, that's not a good enough reason in my mind to delay evaluation or sometimes therapies or whatever may be needed next. So
sure.
It may be helpful in understanding why we're half a step behind, but it shouldn't be a reason for complacency when there's significant delays.
Sure. Right. I've read it might explain maybe 3 months of delay, but beyond that.
Yeah, there's different rules of thumb with maybe somewhat thin evidence. For each language, there may be a couple months delayed per additional language.
Right.
And the list is longer than just bilingual exposure. If you're a boy, if you're the second child, or some say if you're the first child. So there are some reasons that may, on average, when you look at babies across the board, may correlate or may sort of link to slightly slower expressive language. But again, I tend to put those aside when there's a significant concern and just follow up on those issues as needed.
So I'd say a question that I probably get at least once a week is I'll see a 2-year-old that has very few words and they're meeting every other milestone, they're developing appropriately, and parents are really concerned because their child has such few words and they might have a sibling or a friend that's, that is already combining words together. What should parents think about in that situation? Does that raise any red flags to you?
Well,
what should parents be looking for?
I'll tell you my approach. Well, you said something in that setup that's important, that the other aspects of the child's development are going fine. They may understand language well, they may have good social interactions, they may have good motor skills. So it's purely an expressive language deficit, say, so meaning the ability to say words. Having said that, so the balance here is that we know the majority of those kids that are late to start talking, and that can run in families a little bit. So we call that familial late talkers. So the majority of those kids will launch into speech at some point and be completely fine. But we're not great at figuring out the future and say for sure that's going to be the path. That's the path for the majority of cases. But if it comes to exactly the scenario that you mentioned, that by 2 we're not starting to put 2 words together and may have just a handful of words, that is a point where I recommend intervening at some level. And that would include generally doing a hearing test to make sure that there's no hearing issues. I almost never find hearing issues, but it's still something we would not want to miss because we would intervene if we find them. So I would recommend doing a hearing evaluation. And that's an evaluation beyond what's been done as a newborn. So we know that kids that have hearing issues, not all of them are picked up during the initial newborn screen. So if I'm not hearing words at that age, or sufficient words at that age, I would recommend that. And I would actually recommend also a speech evaluation and potentially some speech therapy in that scenario. Now, it may be that it's all for nothing and then that child would have been talking up a storm regardless of what we did. But there is also the concept that for some of these developmental issues, intervening earlier can be helpful.
Yes.
So, and that's always the balance. How much to inconvenience families and worry families with jumping on this evaluation and management, but we also don't want to overly delay helpful therapies, for example, when by just dragging our feet. So, and the 2-year visit is actually that's the exact right time where I'm very careful to sort of decide on which side of the fence I'm in, and along with the family decide, are we worried enough that we need to take further steps, or can I be reassuring here?
I think you hit the nail on the head. As a pediatrician, I think what's so tricky is that balance between, wanting to be reassuring and not worry parents, but you also want to intervene when it can be beneficial and helpful. So I couldn't agree more. And
it perhaps not worth saying, but I'll say it anyways, that all of these are discussions with the families and their preferences as to how to approach what we're seeing. So it's never a cookie cutter response to a situation. It's sort of a conversation we have with the family about what I may see, potential concerns that I have, and sort of a set of options of what to do next. And I do see a full gamut of preferences. Some may want to wait a little longer to intervene. Some want to jump right on it and sort of do as much as possible early on. So that's also, of course, a part of that decision process.
I agree with that too. You kind of feel out the family and see what their style is, what they prefer. I agree. Some parents prefer to intervene earlier, be more, proactive, and some parents would just prefer to wait a little bit. I agree with that.
I would say, and I thought this is where you were going, but I'm sure you do the same. Whenever there's even a conversation about possible speech delay, it's a great opportunity to review with families the things that they can do in the house at home to really stimulate the development of speech. So reading aloud every night to their child is a great habit. Even for toddlers that have a 30-second attention span, is still a good thing to get into the routine of looking at even a page in the book and have a conversation about it each night. Hearing a lot of language and sort of narrating what you do through the day. I think those exposures to language, and particularly reading aloud, have been shown time and again to be helpful in long-term, not just language, but also reading skills, etc., sort of further down the road. So important, regardless of the child's language ability, is to emphasize those skills.
I thought I would also ask, there's a lot of sort of more quirky or I don't want to say the word unusual, but more atypical behaviors that a lot of parents will note, and they'll express their concern to me. So I thought I would go through some of those with you and get your take, if that's okay.
Let's do it.
Let's do it. Okay. So the first one is a lot of parents will say their kids are very sensitive. So they'll be very sensitive to loud noises like a blender, or very sensitive to, food textures, or sensitive to tags on their clothes, and they're worried that this is a concern about their child's development and what it means. And I hear this term a lot, sensory processing disorder, and I just wanted to ask you your thoughts on this, because it's a term that I never learned about in medical school or residency, but I hear about it a lot now. What do you think? Do you think some of these behaviors are worth giving a diagnosis? Are they normal? Do you have any thoughts?
So in terms of the behaviors themselves, and I'll get to your more specific question about the sensory integration.
Yes.
In terms of the behaviors themselves, I think analogous to what I mentioned before, none of these things in isolation are worrisome to me. Kids have a sort of kids are not all the same, and we're all in some spectrum of how much we tolerate certain things and how much we may be bothered by textures or routines, etc. So as individual issues, sort of being sensitive to noise or having some sensory concerns, by themselves don't worry me. It is true that if you lump many of these issues together along with other concerns, they may represent a more general developmental problem. So that's the context that I put it into. So I may look at their language skills. I might look at their social skills. I might look at their motor skills in addition to what they describe. And if that's really the only isolated issues, then I can feel comfortable in being reassuring about them. If there are multiple concerns in multiple of these areas, then I think we need to look further about developmental type that would potentially be concerning.
Yes.
I don't myself use as a diagnosis sensory integration for a couple of reasons. First, there isn't at this point a framework for diagnosing it that's been studied and researched and proving to be a useful diagnostic term. So we don't have a tool that says this child has it or that doesn't have it. In fact, that's one of the reasons that the American Academy of Pediatrics has for years now discouraged the use of this term. That's not to say that children don't have sensory issues, and I want to be sensitive to parents' concern about the sensory issues that they are seeing in their children. I think the main risk of the using this term is not in the term itself, but in that it has been linked in some cases to unproven therapies to address this that sometimes can be laborious or expensive, and really with not very much evidence, and there's a long list of these, but without any much evidence that it's helpful. So we're entering an area where there's not a lot of evidence of benefit in terms of therapies in this domain. So I'm very careful to how I tread on that, and at least in what I recommend. Despite my views, some parents still pursue these. So as long as they're not dangerous, and I tell them sort of my perspectives on this, I'm of course okay with parents addressing these issues or maybe availing themselves of these therapies. But it's not something that I feel comfortable encouraging myself, given the lack of evidence at this point. And I would say, there may be, if it has implications for the child's day-to-day life, I think addressing them in some behavioral manner makes sense. But there are some very, as you know, but your audience may know, there are some very specific and expensive therapies that are targeted at some sensory integration issues. And these therapies, by and large, don't have a strong foundation in scientific evidence. So we're entering an area where we just don't know much about it, and it's hard to recommend an expensive and protracted therapy that really has not shown effectiveness.
Yes.
I suppose as long as it's not dangerous, families they can make a different choice than what I might suggest, and that's okay. But that's at least I want to offer them my perspective on it so they can make an informed decision.
I totally agree with you. I think the only part where I hesitate is I'm always fearful to give children labels unnecessarily, just because I worry psychologically if they grow up and they believe they've been told they have a problem when it's really just what's in the range of normal for a child. That's the only part where I give hesitation to the term, but I agree if it doesn't harm a child.
I never use it myself, as I said, and I think in part for that. And I agree by and large with labels, although there are some situations in which a label can be a useful framework for the family to rally help around the sort of a child's multiple issues. I know we experience this, identifying attention deficit hyperactivity disorder in a child can be open up a range of interventions that actually have good evidence. So in some instances they can be helpful. And I would say that some of the parents fear that this label will somehow go on their permanent file or that the colleges will find out about it at some point is probably overblown. And that I agree not to create the sense that there's something wrong with the child that can be a problem. But I also think that in some instances where we have a good methodology for reaching a diagnosis, they can open up the opportunity for helpful treatments.
Right. I totally agree. And I think to me that's the big picture important point, is that if there's something that's getting in the way of the child's life and there's something that we can recommend to make things better for the family, that's well worth it.
Yeah.
So,
particularly if it's based on evidence, I feel particularly comfortable in making those recommendations.
Okay, so now a big question that comes up that I think is on a lot of parents' minds as an underlying concern is autism. Can you touch on? I mean, I think when I talk to parents where their children have speech delay, when I ask them about it, that's really what they're concerned about. What are signs of autism? What should parents be looking for, generally speaking?
So autism generally has, well, as I think our families are aware of it, children with autism can have a broad range of developmental capabilities. So from developmental challenges that really limit the child's sort of range of activities to ones that really have little impact on their day-to-day. But generally, they represent a combination, and not always all of these, of social challenges and social connection, and that's probably the most important component of that, with often some language delays or limitations, and then some set of behaviors, again, not universally, like repetitive behaviors that raise the concerns.
There's a case I remember about from residency, actually, where you really helped me. In residency as pediatric, when we're training, we see the patients first, and then we go back and we talk to you about them. And I remember I saw a child who was, maybe a year and a half or 2 years old, and I said, "Oh, this kid's doing great." I saw the child, and he was pretending. He had a phone in his hand, and we went into the room. And the child was taking the phone and sort of banging it repetitively on the wall. And you said to me, so there's a difference here. You see the child's not actually pretending with the phone, not talking on the phone, but using the phone to bang repetitively. And that's a difference. And you were concerned about the kid having autism. And I always learn from that case because now when I talk to parents, it's not just about are they playing with toys, but it's how are they playing with toys? Are they using it in a pretend fashion?
Yeah, so are they pretending the car is a car and rolling it around the ground, or are they just looking at the wheel and spinning the wheel and focusing on that? Those are two very different ways of playing with cars. I can't help when because this is sort of a growth in my own growth over this last decade or so, as through the advocacy, largely I think from the community of those with autism, about framing these atypical developments not as necessarily deficits, but just the concept of what's neurotypical or what's sort of different ways of sort of seeing and processing the world. So yes. That we are not stigmatizing with the diagnosis and accept our children for the way they are wired and see the world, but in some cases also want to provide with sort of the tools to navigate the world as it is as well, and that's sort of the reason for making the diagnosis and providing therapies is to help navigate the world, but not in a way that necessarily stigmatizes those that have other ways to look at our world and interact with our world.
No, very, very well said. Very, very well said. And I also think some of the benefit to finding the diagnosis early, as you mentioned, is we can intervene and support the child and make progress by an earlier diagnosis.
Yeah, and that's been shown again and again that can be helpful.
Sometimes parents will say to me, their child bangs their head, against the crib or against the wall repetitively, and they're concerned that means their child has autism. And what would you say if that was found in isolation with no other concerns?
Well, the first question is how old they are, which I might know already, because and this comes up all the time. Some of the completely normal behaviors of a 9-month-old would be concerning if a 3-year-old is doing, but are completely normal in a younger child. So what you describe is completely normal in a younger, say a 9-month-old or 12-month-old. But if it's an older, if it's a 2.5-year-old that's doing that, it would make me ask some more questions, potentially pull out that MChat to see are there other areas where we should also attend to. But just with sorry if I sound like a broken record, but what I mentioned before is if that's the only isolated issue, it rarely represents a problem. But if it's combined with other concerns, it can be a sign of something bigger.
Anything else that we didn't touch on that you want to bring up?
No, we covered a lot of ground, so thank you for the opportunity.
Yes.
But I do want to stress a point that I sort of made somewhere along the way, that the most important way that we screen for developmental problems is through the parent's eyes. So parental
Yes.
concerns are really and that's also actually there's good evidence to support that besides our experience, are a very important component of how we assess the child. Of course, we can bring knowledge to that discussion as well. So I think if a parental concern, sometimes we can be reassuring and put it in the context of normal development. But I think, but I always grateful for the opportunity to hear the parents' concerns, so we can open up the discussion about this really important aspect of a child's upbringing.
I completely agree with you. I always like to know, you said it very well. I really like to know what's on the parents' minds, what they're concerned about, because they're going to tell me if there's a problem. And if I can be a reassuring voice, then I feel great about it. That's great. But oftentimes, if we're going to pick up on something that needs more attention, it will come from the parents. Absolutely. Thank you so much. Thank you for all of your expertise, and I appreciate your time. It's really a pleasure.
Always great to have a chance to talk to you. So.
No, thank you so much.